No doctors, no pharmacy, no WebMD to convince you it's probably fatal. And yet, ancient humans figured out actual medicine, including a surgery involving drilling a hole straight into someone's skull while they were still conscious. And people survived it. Let's talk about how ancient healthcare actually worked, because some of it is genuinely wild. And before you assume ancient medicine was just some primitive guesswork with zero actual logic behind it, nope. There's real evidence of deliberate plant medicine, actual surgery with survival rates, and honestly, evidence of something even more important than any of that: ancient humans taking care of each other. Let's actually break down what getting sick or hurt looked like tens of thousands of years ago. Quick thing before we dive in. If you're new here, we cover ancient history and human origins like this every week. Real research, zero boring textbook energy. Hit follow now so you don't miss the next one. So here's genuinely one of the most emotionally wild archaeological finds in all of prehistory. At a site called Shanidar Cave in Iraq, researchers found the remains of a Neanderthal, now known as Shanidar I, who had an absolutely brutal list of injuries. He was blind in one eye, had a partially amputated or badly damaged arm, and had survived multiple serious fractures throughout his body. Any one of these injuries alone would have made surviving as a hunter-gatherer incredibly difficult. Here's the part that gets me. His bones show clear evidence of healing, meaning he didn't just survive these injuries in the moment, he lived for years afterward. Years, as someone who, frankly, would have really struggled to hunt, gather, or fully take care of himself. Which means somebody, or more likely an entire group of somebodies, was feeding him, protecting him, and nursing him through his recovery, probably for a genuinely long stretch of his life. This is widely considered some of the earliest solid evidence of actual communal healthcare in the human story. Not medicine in the sense of pills or procedures, but the far more basic, far more important foundation underneath all of it: people choosing to keep taking care of someone who couldn't fully take care of himself anymore. Okay, so ancient humans clearly cared for each other. But what did they actually do when someone got sick beyond just, being nice about it? Turns out they had an actual medicine cabinet. It just looked like a garden. So here's a genuinely clever piece of detective work from researchers. At a site called El Sidran Cave in Spain, scientists analyzed the actual dental tartar, basically the ancient plaque, still stuck on the teeth of Neanderthal remains dated to around 50,000 years old. And inside that tartar, they found chemical traces of two specific plants: yarrow and chamomile. Now, here's why that's actually a big deal. Both of these plants are bitter and offer basically zero nutritional value. If you were just eating whatever tasted good and filled you up, these would be a genuinely weird choice. But researchers also found that these same Neanderthals carried a gene that lets you specifically taste bitterness more strongly. So think about that combination for a second. These Neanderthals could clearly taste exactly how bitter and unpleasant these plants were, and they ate them anyway, repeatedly. That's not an accident. That's the ancient version of choking down medicine you know tastes terrible because you know it'll help. Researchers believe this is genuine evidence of deliberate self-medication, using yarrow and chamomile specifically for their medicinal properties, the same basic plants that are still used in some herbal remedies today. And this isn't some isolated one-off behavior either. Scientists point out that lots of animals, including many primates, engage in similar self-medication behavior, deliberately eating specific plants when they're sick despite the plants offering no food value. So this wasn't unique to humans inventing something totally new. It was ancient humans building on an instinct that already existed way back in our broader evolutionary family tree. Okay, so plants for minor stuff makes sense. But what did ancient humans do for something way more serious? Because the answer here is genuinely one of the wildest things I've ever covered on this channel, and I need you to brace yourself. So this practice is called trepanation, and it is exactly what it sounds like: deliberately cutting, scraping, or drilling a hole into a living person's skull. No anesthesia, no antiseptic, just stone tools, and presumably an enormous amount of trust in whoever was holding them. And here's the part that genuinely blows my mind. This wasn't some rare, one-off, desperate act. Archaeologists have found trepan skulls from sites all over the world, and one of the oldest confirmed healed examples comes from a site in Ukraine, dated to somewhere between 10,000 and 8,000 BCE. That word healed is doing a lot of work in that sentence, by the way. Healed means the bone had time to grow back around the edges of the hole, which means the person didn't just survive the actual procedure, they lived for a real stretch of time afterward. Considering there was no way to prevent infection and no understanding of germs at all, the fact that so many people survived this is honestly kind of remarkable. So why were people doing this? Researchers genuinely aren't 100% certain, and it's a real ongoing debate. Some evidence suggests it may have been used to treat serious head trauma or relieve pressure from skull fractures, which would actually make a decent amount of practical sense. Other researchers point to evidence that some trepanation may have been tied to spiritual or ritual beliefs, an attempt to release evil spirits, relieve conditions like severe headaches or seizures that ancient people may have interpreted as supernatural possession, or some other ceremonial purpose we don't fully understand today. It's very possible both explanations are true, just for different people, in different places, at different times. Either way, someone, thousands of years ago, decided the solution to a serious problem was, let's open up the skull and see what happens. And it worked often enough that the practice stuck around. And if skull drilling wasn't wild enough for you, archaeologists also found evidence of something even more surgically advanced, and it's actually the oldest known surgery in the entire world. So in 2022, researchers made a genuinely stunning discovery in a cave in Borneo. The skeletal remains of a young person who had part of their lower leg surgically amputated, dated to around 31,000 years ago. This instantly became the oldest confirmed evidence of surgery anywhere in the world, beating the previous record by tens of thousands of years. And here's what makes this genuinely impressive rather than just gruesome. The bone at the amputation site shows clear signs of healing, meaning this person survived the surgery itself, survived the recovery, and lived for years afterward based on the evidence. Whoever performed this procedure would have needed real, functional knowledge of anatomy, how to actually stop the bleeding, and how to manage the wound well enough to prevent a fatal infection, all without antibiotics, all without modern tools. That is an extraordinary amount of applied medical skill for 31,000 years ago, and it completely upends the old assumption that early humans only had crude, guesswork-based medicine. This was intentional, skilled, and it worked. So here's the actual takeaway. Ancient healthcare wasn't primitive guesswork. And it definitely wasn't just people suffering through illness and injury with no help at all. From communal caregiving that kept severely injured people alive for years, to deliberate, evidence-based plant medicine, to genuinely skilled surgery performed tens of thousands of years before anesthesia or antibiotics existed, ancient humans were consistently, actively working to keep each other alive, using whatever tools and knowledge they had. It's honestly one of the clearest through lines connecting ancient humans directly to us today, long before hospitals, long before medical school. The basic instinct to care for the people around you when they're hurt or sick was already fully in place. If nobody taught you the actual research behind this in school, follow. We cover ancient history and human origins like this every single week. Comment which ancient medical practice you'd be least willing to try, because personally, the skull drilling is an automatic no from me. And if you want more of this same ancient humans were more advanced than you'd think energy, check out the Ice Age survival video linked right here. Completely different topic, same kind of unhinged resourcefulness.